Why wouldn't you? That's not a good thing. I hate that term. This is a problem. This is quite an imagination without any evidence at all. And this is downright dangerous and very unhelpful and harmful. Does a keto diet cause diabetes or make it worse or help diabetes? That's the video we'll look at today. If you haven't downloaded my top 10 tips to start keto right, look in the description below. I'm Dr. Eric Westman. I'm at Duke University, and I started studying low-carb keto diets over 20 years ago. Even changed the name of the clinic at Duke to the Duke Keto Medicine Clinic. So when I see a video and someone sent this to me, it was bound to happen, one that was anti-keto from an organization called nutritionfacts.org. Now, with any organization, you want to look at what's behind it, who founded it, where the money comes from, and all that. So when I look at Nutrition Facts today, I've kind of known about Dr. Michael Greger through the years, and he's got a lot of videos, a lot of content. In fact, it's all for free, and I looked through the Wikipedia about him, and I don't know that he was ever a doctor, really, a practicing doctor, although it says he's a licensed practicing doctor. I didn't find any clinic or organization or university where he was a practicing doctor, which is fine, but you don't want to ask an organization or a doctor who doesn't know anything about clinical medicine or the application of something in a clinic for clinical problems. That's just my sort of background as an internist, and I'm at Duke University, and I can't find any sort of academic affiliation for nutritionfacts.org. It seems it's a nonprofit on its own, and it even got to the degree that I was searching for a few minutes about it, information about the doctor, and I don't know where his paycheck comes from. I mean, they're giving all this away, and he's spending all this time doing books. The books go to charities. Maybe he's independently wealthy. Great. But there's that old saying, he thinks they protesteth too much, that all of this is given away. Well, somebody has to be paying the bills of the staff. And as a nonprofit, you can always wonder where the financing comes from. And I don't know specifically, but my guess is that it has something to do with the plant-based hullabaloo that we're all living through at the moment with very little science behind it. So, I did a PCRM review recently. That's Physicians Committee for Responsible Medicine, Neil Barnard, who is kind of a similar organization that puts a one-sided view on nutrition and health, which, go to them for information about vegetarian diets, but go to someone who knows about keto diets, low-carb diets, if you want to learn about low-carb and keto diets. So anyway, this is said to be by one of my patients, and it's a shame that someone can be doing really well on a program and they come across a video like this on their feed and they start worrying, and the last thing I want them to do is to think they have to do something for a non-scientific reason. So anyway, that said, you want to look at the organization where it comes from, and if you're one of my patients, I would say you don't really want to look at nutritionfacts.org as a source on low-carb keto diets, because as you'll see as we go through this, they basically use either old data or misinformation to kind of fearmonger about what a keto diet might do. So here we go.
Ketogenic diets can certainly lower blood sugars, better than conventional diets, so much so there's a keto product company that claims ketogenic diets can reverse diabetes. But they are confusing.
Wow, I wasn't predicting that. Basically saying keto, oh wait, there's a but.
Using the symptom, high blood sugars, with the disease, which is carbohydrate intolerance. People with diabetes can't properly handle carbohydrates, and this manifests as high blood sugars. Sure, if you stick to eating mostly fat, your blood sugars will stay low, but you may actually be making the underlying disease worse at the same time.
It's interesting. He basically said you can reverse diabetes by not eating carbs. Why wouldn't you? That's not a good thing. So what I'm finding is there is a whole paradigm view. And I get people about with a doubt. I think it's not the other agendas that make people illogical, and it certainly could be. But the old paradigm view is that there's something inside the cell that causes insulin resistance, and it makes the insulin back up, and that causes the diabetes, the high blood sugar. When 100 years ago, actually low-carb diets were used to treat diabetes. There never was a study that said eat carbs and use these medicines to say it was any better than to cut the carbs. So I'm just using a treatment that was used 100 years ago for diabetes, and that thinking this is an obesity medicine thinking, it's different. It's new, where it's the food and the obesity that's causing the high insulin level. And then that's causing the insulin resistance. So it's not something inside the cell that's doing it. It's actually the food and the insulin being high as a result of the food. So totally different understanding of what causes it, which could lead intelligent, well-intentioned people to think that that might be not the way to do it. But no, high blood sugar is actually the way your doctor diagnoses you with diabetes, right? They didn't check you for insulin resistance in a blood test. You can't. You check the blood sugar. So actually fixing the blood sugar and then fixing the obesity and having no evidence of diabetes is reversing diabetes. And it just declared that, which I wish I could stop the video now, but there's more.
We've known for nearly a century that if you put people on a ketogenic diet, their carbohydrate intolerance can skyrocket within just 2 days. Here's the blood sugar response of someone eating sugar after 2 days eating a high-carb diet. Here's exposure to the same amount of sugar after a high-fat diet for 2 days. Their intolerance to carbohydrates skyrocketed on a high-fat diet.
So I've heard that kind of misunderstanding that if you don't eat carbs for a long time and then you eat carbs, the blood sugar goes even higher, so therefore it's bad. Well, it's the carbs that it's bad, not the fact that the blood sugar went high. So in my view, so why would you want to eat that carb again? Well, they want to eat the carbs. That's fine, but this is just a different way to go about things. So if you don't eat carbs for a long time, your insulin does kind of turn off or turn down a little bit because there's this onslaught of carbohydrate coming in. Ben Bickman has a great video about that. Then actually, if you do refeed carbs, the pancreas and the insulin just starts revving up again, but it does take a little time. So any study that's a day or two or a week or two, I just don't listen to those, because in a movie called Serial Killers, C-E-R-E-A-L, or Serial Killers 2, in the movie, the second one, basically they chronicled a couple who did keto until they fat burned as much as they could, and then they went in a rowboat to row from San Francisco to Hawaii, kind of this heroic effort, and they broke the world's record, and they waited 6 months, though, to do it, because it took that long to fully adapt, to fully fat adapt. And so any study that's in the first couple days or a few weeks really aren't relevant to the long-term change that can happen.
1 week on a 80% fat diet, you can quintuple your blood sugar spike in reaction to the same carb load.
I hate that term, spike. I hate it. I'm sorry. How about increase or go up, and so we come to the cutting. Please don't say spike. Tell me the number. And I'm always saying, well, no, what was the number? 102. And milligrams per deciliter. That's not a spike, although you'll hear it talked about that way. So anyway, again, a short-term study
compared to a week on a low-fat diet. Even a single day of excessive dietary fat intake can do.
What's very interesting is that the shorter the duration, it makes it even more persuasive for him, for me it's less persuasive, because that's just a day. I mean, you need time for this to change.
If you're going in for a diabetes test, having a fatty dinner the night before can adversely affect your results. One meal high in saturated fat can make the cause of diabetes, carbohydrate intolerance, worse.
So that's, again, an old paradigm view that saturated fat causes diabetes. actually led to the whole low-fat diet for diabetes tragedy at debacle. Basically, all these people were given carbs and insulin and told, because it's the cholesterol is causing heart disease, just do a low-fat diet and don't worry about the treatment of the diabetes. No, the diabetes is the worst thing, not the cholesterol. But this is the old paradigm. I mean, basically, when I was in training in the 1980s and the early 1990s, this was prominent, and now it's fading away because the science just isn't supporting the fact that saturated fat is bad. And the researchers all have a paper that is a consensus statement basically saying that there's no evidence that saturated fat in the diet is bad for anything. But the difference between researchers saying it and then the public and different organizations saying it can be, a long ways away.
Now, with enough weight loss by any means, whether from cholera or bariatric surgery, type 2 diabetes can be reversed.
It reminds me of going back 20-some years. Dr. Dean Ornish used to say, the Atkins diet makes you lose weight, but you can have chemotherapy, and the Atkins diet is chemotherapy. No. And it's interesting that they'll use cholera, which, of course, everyone would say that's ridiculous to lose weight with cholera. But then bariatric surgery, and so in a clinical setting, there's a role for bariatric surgery. There's a role for medication. There's a role for diets. And so this is really out of the almost fathoming of a clinical setting when we use all of these different tools when they're necessary and needed. And I guess this is something that an internet influencer can just say. But I've seen people helped with bariatric surgery and medications and a keto diet, not from cholera. I agree with that one.
But a keto diet for diabetes may not just be papering over the cracks, but actively throwing fuel on the fire. I've been trying to think of a good metaphor. I mean, it's easy to come up with things that just treat the symptoms without helping the underlying disease, like giving someone with pneumonia aspirin for their fever instead of antibiotics. But a keto diet for diabetes is worse than that, because it may treat the symptoms while actively worsening the disease.
So, have you heard any evidence that it's bad in worsening it? No, and this is a problem. There's no science saying it's bad, and yet they're saying, it could be bad. And the language is very interesting. It's best I can tell, it's a political language. It may, could possibly, so that no one can really hold the statement accountable to, but there's no one sticking up for it. Oh, wait. I'm director of a keto medicine clinic, so I'm sticking up for a keto diet, but there's no company that's going to be going out and saying, you can't say that. Very interesting. There's no watchdog that says you have to be careful about what you say about nutrition, unfortunately. The metaphors get better. Hang on. But remember, there's no evidence that keto diets are bad.
So maybe it's more like curing the fever by throwing that pneumonia patient out into a snowbank. Or maybe curing your amputated finger by amputating your hand. No more unsightly finger stub. One of the co-founders of masteringdiabetes.org suggested it's like a CEO that makes their bad bottom line look better by just borrowing tons of new cash. The outer numbers look better, but on the inside, the company's just digging itself a deeper hole. Remember The Club? Maybe I just watched too much late-night TV growing up, but it's a car anti-theft device that attaches to your steering wheel and locks it in place, so the steering column can only turn a few inches. Imagine you're in a car at the top of a hill with the steering wheel locked. Then the car starts rolling down the hill. What do? Oh, did I mention there's also something stuck under your brake pedal, too? The keto diet equivalent response to this situation is, who cares if you're
This is quite an imagination and quite a bit of persuasion here without any evidence at all. And yet, let's keep going down this hill with our steering wheel locked and a baseball under our brake, and because that's keto, it's ridiculous. Let's keep going.
barreling down into traffic with no brakes and a locked steering wheel. Just stick to really straight, deserted roads without any stop signs or traffic lights. If you do that, problem solved. Yeah, the longer you go, the more speed you'll pick up, and so if you should hit a dietary bump in the road or start to veer off the path, the consequences could get more and more disastrous with time. But if you stick to the keto straight and narrow, you'll be A-OK. In contrast, the non-keto response would be to just unlock the steering wheel and dislodge whatever's under your brake. In other words, fix the underlying problem instead of just whistling past and then into the graveyard.
If it wasn't so ridiculous, I was laughing at first with this metaphor, but if you're one of my patients and you're in trouble, sugar addiction, a myriad of things can be a problem, and you watch this, and this gives you that inkling of doubt that takes you off a path that you're on, that can be a long journey to get better, then this is downright dangerous and very unhelpful and harmful. If you're someone doing well on an approach that is against what this group says to do, don't use this information to dissuade you. You want to measure the things that your doctor is measuring, and certainly if you're one of my patients, would say, don't even listen to this group. It's too biased. And to eventually be in a car that you can't steer, going down a hill, careening, this is nothing like getting better by changing the food. And it's really kind of sad that this is out there, and I hope it's just preaching to the same choir of people, and it doesn't dissuade other people from looking into something that has helped so many different people. But let's carry on, keep going.
The reason keto proponents claim they can quote-unquote reverse diabetes is that they can successfully wean type 2 diabetics off their insulin. But that's like faith healing someone out of the need for a wheelchair by making them lie in bed the rest of their lives. No.
Oh my goodness. No, it's not. So how can you, doctor, put up a peer-reviewed journal that probably is one of the best diabetes studies ever done? Not very many people, and all these people came off insulin, and they're following up these people. And this is the approach I use in my clinic. The clinical use of this is way beyond the science. How can you say that that's faith healing? Can you show me a randomized trial or a non-randomized trial of faith healing, please? And to say someone's lying in their bed, coming from my office where people are getting out of wheelchairs and getting better. And if people are following your approach, great. More power to them. They're doing great. But don't tell my patients that this approach isn't working when it is. By fear-mongering, please don't tell me that, and don't tell my patients that. I won't tell your patients to do anything different. If they're doing well and they like what they're doing, great. But to say this is like faith healing is anti-scientific. It's what university are you a member of again? This it is really sad, and yet I know it's out there. Let's keep going.
Need for a wheelchair if you never move. Their carbohydrate intolerance isn't gone. Their diabetes isn't gone. It could be as bad or even worse.
So, yes, it is gone. It could be as bad, or even it might be, follow what's happening in front of your own eyes, please, my patients. This is really kind of dangerous if it's going to tell people who are kind of struggling with an approach that they need to think that something else, which may not work at all for them, is the way to go. Then you'll just keep searching and trying to find the right thing and may never find it. But
type 2 diabetes is reversed when you can wean people off insulin eating a normal diet like everybody else. Then and only then do you not have diabetes anymore.
So that's interesting. Again, this is an old paradigm idea that everyone should be able to have bread, and actually it was a banana that came up on the screen. Everyone should be able to eat tons of bread and carbs. I mean, it's in the food pyramid, right? No, the food pyramid is not scientifically based. And no, some people can't tolerate those foods without the blood sugar going up or without developing obesity. And a simple fix is to cut the carbs out of the food. I don't know why the holy grail is to be able to eat your donuts and your bananas and your quinoa and not have the blood sugar go up. I mean, great if it works for you, but if it doesn't, don't think that that's the only way.
A true diabetes reversal diet is practically the opposite of a ketogenic diet.
Went really fast, but I knew Jim Anderson. Jim is at the University of Kentucky, where I trained. I was Stanford, Wisconsin, Kentucky, Duke for the last 30 years. And Jim was known, Dr. Anderson was known as the brand man. Had a book, Bran and Fiber, and in a very specific context of high fiber diets, you can actually impact blood sugar and reverse it. It was a very difficult diet to do, as I recall. It was hard to keep people on it. But if that works for you, great. There are a lot of diets that can work. And just because a certain type of high-carb diet works doesn't mean that a low-carb diet can't work. Do you see that fallacy of logic?
Diabetics off their insulin within a matter of weeks, eating more than 300 grams of carbs a day. The irony doesn't stop there. One of the reasons diabetics suffer such nerve and artery damage is due to an inflammatory metabolic toxin known as methylglyoxal that forms at high blood sugar levels. Methylglyoxal is the most potent creator of advanced glycation end products, the so-called AGEs, which are implicated in degenerative disease from Alzheimer's disease and cataracts to kidney disease and strokes. You get AGEs in your body from two sources, eating them preformed in your diet or making them internally from methylglyoxal if you have high blood sugar levels. On a keto diet, one would expect high exposure to preformed AGEs, since they're found concentrated in animal-derived foods high in fat and protein, but we would expect less internal new formation due to presumably low levels of methylglyoxal, given lower blood sugars not eating carbs. Dartmouth researchers were surprised to find more methylglyoxal, though. A few weeks on the Atkins diet led to a significant increase in methylglyoxal levels. And those in active ketosis did even worse, doubling the level of this glycotoxin in their bloodstream.
A couple problems there. Short-term study. Changing a level in the blood is just not very powerful information for me. But this is a classic whole paradigm sort of thing, to take a certain condition that isn't true and to say, therefore, that condition can't be true. So high-carb diets lower diabetes and get people off insulin. Therefore, low-carb diets can work. Well, that's fallacious. In 2 weeks, a marker goes up. Well, that has nothing to do with clinical relevance of the entire organism, the entire human, over a period of time.
It turns out high sugars may not be the only way to create this toxin. One of the ketones you make on a ketogenic diet is acetone, known for its starring role in nail polish remover. Acetone does more than just make keto dieters fail breathalyzer tests and develop what's been described as rotten apple breath. Acetone can oxidize in the blood to acetol, which may be a precursor for methylglyoxal. That may be why keto dieters can end up with levels of this glycotoxin as high as those with out-of-control diabetes, which can cause the nerve damage and blood vessel damage you see in diabetics. That's another way keto dieters can end up with a heart attack. So the irony of treating diabetes with a keto diet may extend beyond just making the underlying diabetes worse, but by mimicking some of the disease's dire consequences.
I didn't follow the 2-week study. They blown out of proportion. Actually, the breathalyzer thing is curious. I don't think it's very common. There was a case study once, but I had a student come through our office looking at people's alcohol levels and breathalyzers, and I don't think that's very common if it does interact there. So A lot of speculation. Going to a person who's never done any research or seen a patient on a keto diet, and by the way, the breath is not bad in everybody, very rare. I think it depends how you do it, how you're taught to the diet program with all these different side effects can be mitigated if it happens to you. But that shouldn't be a reason for you not to improve your health by whatever means. We used to make, this is, I might be going out a little out of limb, but we used to make fun of Dr. Anderson's ward because the brand ward was kind of known for one side effect of having the vegetable matter that I won't mention. I'm, I knew it actually in a video about this doctor and this group, and the best thing is to just kind of use them for what they're good for, which is for information about vegetarian types of diets. It is biased in one direction, and I wouldn't go to them as a source of information about diabetes being worsened by a keto diet. We just don't see that. I hope that's helpful, and if you have an idea of a video you'd like me to do to react to as well, let me know down below. Be sure to like if you liked it, subscribe, ring the notification bell, and send this to a friend that this is a grassroots effort. If you don't have my top 10 tips on how to do keto right, please look in the description below. Till the next time. If you enjoyed this video, be sure to like, subscribe, and hit the notification bell. And check out adaptyourlifeacademy.com.